And with that, we are going to go to our next topic, which is, I believe, a very interesting topic. I'm pretty sure people have been searching for this. So it's time to learn about something powerful, the powerful potential of peptides, right? So these are small chains of amino acids which play a crucial role in supporting the immune function, fighting diseases, and even aiding in cancer treatment. So our next speaker is Dr. Ashwani Garg. And let me bring Dr. Garg to the stage. Allow me to introduce you. Welcome to the conference, Dr. Garg. How are you doing?
Thank you. Thank you so much, AJ. Thank you so much.
Give me a minute to introduce you. So, Dr. Garg, pretty much another renowned face. He is the renowned functional medicine practitioner in India and the co founder of the Functional Medicine Clinic as well. Dr. Garg has helped countless children with autism through his innovative approaches. His deep passion for functional medicine has led him to creating a learning disorders program for autism and aiming to transform lives across India. And today he's going to give a spotlight on the potential of peptides in cancer. Thank you so much, Dr. Garg, and over to you.
Thank you, AJ. Okay, good evening, good afternoon, everyone. So I think pretty much we understood that cancer is it doesn't happen out of nowhere. There's a problem in the body. We are not healthy enough. Our immune system is compromised. Okay, that is the reason why somebody will start developing cancer. So it is important to understand the strategies. How do we maintain our health? And this is what we are talking about. We are not per se getting into treatment of the cancer, but rather how do we keep ourselves healthy? Thereby, we keep the cancer away. And of course, there are strategies some practitioners shared where they could solve the problem also. But my focus is more prevention. Okay. Now, we know fairly squarely that when immune system is compromised, there's a higher chance of cancers to grow. Of course, natural cell killer cells, T cells, dendritic cells, they all has a role to find out the cancer cell and just knock it out. But then when our immune system is compromised, our health is compromised, this is where potential that these guys will start growing, right? So a weakened immune system can contribute to the cancer growth. So what do we learn out of this? If we can strengthen our immune system, potentially we can prevent it and we can fight it also. Now, as we age, or our body has accumulation of these chronic infections, the parasitic infection, the fungal infections, or viral infections of various kinds, these infections can down-regulate our immune system. When body has nutritional deficiencies, the body needs nutrition, body needs the basic nutrition that we are requiring to have cell function. When we are low on the nutrition, this is where immune system becomes weakened. This is where chances of any disease along with cancer will grow. Okay, if body has loaded bin toxins, especially heavy metals, microplastics, etc., that also can weaken the immune system. Heavy metals are immunotoxic. Okay, so these are some of the factors which can make the immune system weak, thereby chances of cancer or our ability to fight cancer becomes poor. Right? So if we have to keep ourselves healthy, if we have to fight a disease, if we have to fight cancer, if we have to get into longevity, this is some of the things that we have to ensure that we do it for ourselves. For example, we ensure we optimize our mitochondria. Now, I think from the morning, everybody is talking about that cancer is also metabolic disease, which means mitochondria is compromised, which means ability of the body to consume sugars and produce ATP out of it is compromised. So if we improve our mitochondrial function, thereby ability to fight the problem gets better. We have to enhance our organ function. For example, liver, thyroid, immune system, cardiovascular, blood supply, oxygen supply. Now, if our organ function is compromised, our thyroid is compromised, our blood flow is compromised, then effectively we are not able to supply the raw materials to the whole parts of the system, thereby immune system, thereby ability of any disease and cancer can grow, right? Of course, our microbiota will keep us healthy, and diversity of the microbiota means health. So if this is compromised, we want to improve. Make sure we remove the toxins, make sure we remove the microplastic, etc. Nourishment is the key. We have to feed ourselves what this body needs. Our cells needs the basic raw materials. We cannot do away with that. Of course, a circadian biology, making sure that we get a lot of sunlight, and after it is sunset, darkness is also healthy. Okay, circadian biology simply means following the sun cycle. When sun comes up, we get sunlight. When sun goes down, we stay under darkness. And this too much of brightness after sunset, having a Diwali after sunset is a problem. And we maintain our hormonal balance, we maintain our neurotransmitter balance, we reduce the stress, and of course we continue with some physical activity. If body has to be healthy, body needs to have a trigger for health, and exercise movement is a trigger for health, right? Sleep is very, very important. Sleep at the right time is extremely important. Daytime, we are all metabolically active and we are just producing energy and we are consuming ourselves. And night is the time when we go to sleep and we repair, replenish our energies. If we are always running the engine, you don't allow the body to repair. This is where the problem is, right? Sleeping at the right time is very, very crucial. And hydration, of course, 80% of this body is simply water. If any right chemical, biochemical, mechanical reactions have to happen in this body, hydration is very, very critical. Now, in all of these things that I talked about, peptides can be a game changer, can be a major player which can help us restore our function. Now, these are nothing new to the body. These are biosimilars. Peptides are small chain proteins which are produced in the body, and they have a signaling effect on the body. They're sort of a signals to the body. Body will make these peptides by its own and allows the body to signal for different things. And when these peptides out of disease, out of unwellness, or out of aging, amount of peptides start decreasing, this is where aging will happen. This is where disease will happen. And this is fairly one of the theory behind aging. Okay. The doctor who has worked almost his life, which is Dr. Kevinson, he was the doctor to President Putin. So imagine, look at President Putin. He's so healthy all these decades, and probably one of the reason behind it is the peptides. Okay, and last year, I think early this year, we lost this Dr. Kevinson, who has spent all his lives figuring out these peptides and bringing them to the market. Of course, now US is catching up, India we are catching up, but it's a big game. Very, very powerful stuff. Okay, and one of the major peptide could be epithelone, which is a pituitary hormone, and we're replacing from outside. Now, if we get that, our telomere we can increase the length of the telomere. It can be worked into anti-aging. It can delay diseases like heart disease, dementias. It can enhance mental clarity. It can improve sleep by improving melatonin production. As pineal gland hormone improves, it take care of other hormones also. It improves your thyroid hormone, it improves your testosterone, it improves your melatonin. So it's a master gland peptide. So it has an effect overall on the system. It improves your skin, it improves your eyes. So at the end of the day, if you are healthy, your body is healthy, your organ function is healthy, your hormones are healthy, you're easily able to fight the problem. And of course, the cancers. Another very, very important peptide, which is called BPC-157. Another, which is a master peptide, we call it a repair peptide. It can have a tremendous effect on the gut. Typically, this peptide is produced by the gut, and it has a healing effect on the gut. I mean, Dr. Ruhi spoke about a leaky gut, etc. This peptide can be a game changer for healing the leaky gut. Along with that, it also has ability to repair any injury. It also has anti-inflammatory effect. It also has a cardio protective effect. And of course, it has a major role in brain health also. And of course, it upregulates the growth hormones. So again, another very, very potent peptide, which can have an overall effect on bringing health. Again, like I mentioned, if we have health, it is a higher possibility that we can fight the disease, we can fight the cancer also. Another very, very important peptide, which is called a thymus peptide, thymosin beta 4, which can balance the immune system. Okay. Again, very potent for wound healing, very potent for muscle repair, growth, have anti-inflammatory effect, neuroprotection, improves immune system, have anti-aging effects, etc., etc. Now, point I'm making is these are small molecules. Body understands it very well. When you take a drug, it's a very, very foreign thing to the body. But when you take a peptide, it's something body understands. It's biosimilar. It is there in the body, produced by the body, but for some reason, it is not enough in the body. And you take it from outside, and it has a multifactorial action, just bringing the homeostasis in the body. Another very, very important peptide which is thymosin alpha 1, which modulates immune system. It promotes T cell differentiation, thus promote tumor immunity. I mentioned in the beginning, if immune system is healthy, our fight against the cancer becomes much, much more easy, right? It helps assist the development of B cells to plasma cells, thus produce amounts of antibodies, immunoglobulins, and improves the humoral immunity also, right? It's all about bringing a balance, homeostasis, improving our organ function, improving our vitality, improving our detox potential, and improving our immune system. This is another. This is GCMAF is not really a peptide, but it's again a glycoprotein, very very potent. This is present in the body, and some companies are making it in the form of a supplement. And typically, it is also used in cancer treatment. And the one we get it from Japan, and these guys have been doing a lot of good work in that area. And it improves our immune system. It improves the phagocytosis. It improves clearing of the dead cells. It improves modulating immune system. It also has a direct killing effect of the pathogens. Now, a lot of the speakers from the morning said that infections are a player. As, for example, viral infections, parasitic infections, fungal infections, they could be participating in the growth of these tumors. And this guy itself, can help to build the immune system or can have a direct effect on killing these pathogens. Thereby, fight against the cancer becomes much easier. Right? It can recognize and help in eliminating cancer cells also. Right? A lot of work is done in this area and very, very potent. Right? Activating microphages, immune system modulation, neuroprotection, antiviral, antibacterial effects, and anti-cancer properties also. Now, the good part is they don't come with a side effect. Right? These are some things body understands brilliantly. These are things which are there in the body and easy to supplement. Of course, we have to always careful, do it under a guidance of a doctor, etc., who understand these things. The point is, they don't come with a major side effects, and it enables the body. Rather, it is something foreign to the body. It enables the body, allows the body to fight for its own self. Another very, very powerful peptide is called MOTC. Now, again, cancer is also a metabolic disorder. And if we do things to improve the mitochondria, our fight against the problem becomes much better, right? So MOTC will cause biogenesis of the mitochondria. Thereby, it improves insulin sensitivity. If mitochondria becomes better, weight loss becomes better. Dr. Manji spoke about how obesity becomes a risk factor for increasing cancer incidence. Now, if we improve the mitochondria, improve the biogenesis of mitochondria, weight loss becomes better, thereby our fight or chances of getting a problem becomes better. Now, mitochondria becomes better, energy production becomes better, exercise performance will become better, right? Of course, aging also means that as we age, our mitochondria is depleting. So if we use this peptide, we can repair, regenerate our mitochondria. Quality, quantity, the efficiency of the mitochondria can be retained. Thereby, our immune system, 10% of the mitochondria is in the blood. This means a lot of mitochondria are required for the immune system also. And if we improve the immune system, things are much easier. Now, go alongside, if mitochondria is good, your cardiovascular, your heart is pumping good, your blood vessel quality is very, very good, right? Muscle function, brain function, bone function, all of these things will get better. Of course, depending on the need, depending on the situation, depending on the cost, all of these things, we can use different peptides for different patients, but they can bring a lot of positivity to fight our problems. Another very, very powerful, potent peptide is called KPV. It has pain relief. It is anti-inflammatory. It can help in wound healing. And of course, it also has properties of antimicrobial properties, antibacterial properties, right? So a lot of time in our practice, we have to fight these chronic infections in the body. We do the baseline anti-parasitics, antimicrobials, anti-fungal. Sometimes we are not able to bring the patient out of the problem because immune system is so compromised. You clean the infection, it comes back. You clean the infection, it comes back. Then you need more potent things. They're potent, but very simple in nature. That's even the beauty of it, right? These are just tiny chains of amino acids, very, very potent, without hardly a side effects of it. At the same time, body understands them better. So it improves the circulation, it improves the sleep quality also. It also improves melatonin production, right? And Dr. Lenny will be talking about role of melatonin with cancer protection. So the two peptides, KPV and epithelon, will improve melatonin, thereby our protectiveness against any disease and cancer also. Now, the very, very simple peptide, which is called zinc carnosine, gut health is the key. If we have to fight any disease, we have to ensure our gut is healthy, right? So zinc carnosine is another peptide which is very, very potent, can improve gastric mucosa from damage. It neutralizes free radicals. It enhances collagen synthesis. It also helps the natural killer cell activity, right? Of course, it has anti-aging effects also, right? So we just have to understand where they can play a major role for our health. And as that happens, these are tools for our practice, or as population, we want to be healthy, we want to be doing anti-aging for ourselves, which means we want to be healthily aging. There's no way we can escape death, but we certainly can be healthy till we die, right? So this is one tool, one kind of a tool, along with the ozone therapy, along with nutrition, along with other things that we talked about. And this peptides can be game changer. Now, like I said, Dr. Kevinson almost spent 40 years of lives working on these peptides and producing a lot of data. Of course, this data is published in a lot of Russian language and not easily accessible. But now, slowly, gradually, it is becoming more, available to the rest of the world also. So, just to summarize things, if we have to fight a disease, we have to have the better immune systems. Thymosin alpha 1, thymosin beta 4, BPC can improve our immune function. We have to fight the infection. This is where, or the growth of the cancer, KPV, epithelon, and MOTC directly can have a anti-cancerous properties also, right? We have to reduce the oxidative stress. This is where zinc carnosine and BPC 157 can be very, very potent. We have to enhance apoptosis. We want to ensure this cancer cell would die by itself. And this is where KPV, epithelon, MOTC can be a, just to summarize things. Of course, their role is far more diverse and widespread. But at the end of the day, we just have to understand how we can put into our practice. This is where, I'm trying to put a little summary to it. Now, just because thymosin beta 4 and BPC also has the ability to promote angiogenesis and stimulate growth and proliferation, maybe it's the science is not clear. Some practitioners say this could be a problem, some say there's no problem, they haven't found any problem. So these two guys, which is thymosin beta 4 and BPC 157, can be a potential concern when we're dealing with cancer overgrowth in the body. So we can be more careful about it. We just don't want to rush into things. We understand where it is useful, we do those right things. Now, again, there's, we don't have so much data. We don't have so much of, clinical trials around these. These are more anecdotal practice stories that we hear from a lot of the practitioners. Because these peptides, there's hardly any ability to patent, get a patent on them, or, a lot of companies trying to make them a drug. That is happening, but largely because there's biosimilars, difficult to get a patent. So not a lot of data being generated by the pharmaceutical. So this is more, we rely on the Russian data or anecdotes that we generate from our own clinical practice. So this is something in a very, very nutshell I wanted to share with you. Peptides can be a game changer for our practice, but now we are open to the questions.
What an energetic presentation. Quickly closed. I think you introduced peptides even in your presentation. That is why it's closed on time. But jokes apart, we had a very common question in the question and answer box, and it was, where are these peptides available and prescribed by whom?
Yeah.
And when should we consider prescribing it?
Right. So, like I said, there are multiple tools functional medicine offers us, from the diet to the lifestyle, to the nutraceuticals, to the infection control herbs, to the probiotics, to the peptides, and to the regenerative medicine, next level stem cells. So, depending on our ability, depending on our kind of practice, and luckily we are able to bring them to India. So, if anybody is interested, we can help them get that.
And there was another question which was related to whether peptides are available as supplements.
Right. So there are three kind of peptides as of now available. One is, for example, there are animal glands available. For example, you crush thyroid gland in a capsule. You put a thymus gland in a capsule. You can put liver in a capsule, for example. Now, these are all young animal glands put into capsule, crushed and put into capsules. Now, all of our bodies are producing these peptides, right? All of these glands are producing these peptides to repair those glands, specific function of those peptides. Now, as we age, we lose this ability to produce peptides, or probably when we are diseased, our ability to produce these peptides will reduce. So if we take a capsule of that specific gland, for example, thyroid, if we have to improve a thyroid function, we can take a desiccated thyroid capsule. So that's the simplest thing that we can do, right? These things can be easily procured, and you don't need a prescription because these are all nutraceutical supplements in a form. Second thing that is available nowadays is, the peptide is extracted from that gland and put into either a capsule, either an oral thingy. That is also to some extent is available. We're trying to bring more into India. Not easy, but we're trying. Third possibility is, some people don't want to take animal products. So some companies have made a synthetic versions of these peptides. They're made in the lab from the amino acids, but as effective or nearly effective as the natural peptides made by the animal. Now they can come in the form of a spray or an oral capsule, or into subcutaneous injections also available. So depending on everybody's practice, what they want to do, how they want to do, options are available.
And obviously, a follow-up question is how do we actually administer peptides and for how long? How do we consume them? For how long?
Yes. So typically they say peptide course of each of the peptide should be more 4 to 6 weeks. We don't want to extend the peptide course of one time into a long period. So 4 to 6 weeks, one time. You can have multiple peptides going on simultaneously for, let's say, one for the mitochondria, one for the gut, one for the immune system, one for the brain, four of them going together for 6 weeks, 4 weeks, depending on the need. You wait for 2 months, you wait for 6 to 8 weeks, and if required, you repeat the doses.
All right. And obviously, another question was, are there any legal concerns of advising peptides?
So, for example, thymosin alpha 1, you can go to 1 mg and you can procure it. So that's a thing which is already being approved by FDAs and all that. Typically, it is used in people who their immune system is very, very compromised, or especially fighting those hepatitis viral infections. So some of these things have already, for example, another brain peptide, which is called cerebrolysin, which is easily available on 1 mg. Now, because lack of the understanding, lack of the knowledge, like I said, most of the work is done in Russia, right? And slowly the system is catching up with them. So as of now, is you are a medical practitioner, you can put them onto prescription if the patient requires it. And second option, I mentioned that you can take a desiccated thyroid gland or thymus gland, or pancreas gland, like that, just to ensure if you don't want to get into legalities of it.
And a last question, which I could see was, are there any Indian studies which are available regarding usage of peptides?
So this study basis, we have to understand most of the data that is being produced is produced by the pharmaceuticals. Data production needs money. If you are trying to sell a product which don't have a patentability, nobody's interested. And if I restore your function to make you healthy, who's interested in that business? It's more of a business to keep you sick. Disease management is where the business is, right? I keep you sick. I manage your disease. I don't let you off the hook. If I put you off the hook, my business is gone. So as a practitioner, we have to understand the nuances of these things. Just we keep asking for data does not mean lack of data does not mean it is not possible.
So, Dr. Garg, thank you so much for your time. And I could see a lot of, yes, thumbs up and likes and everything. Wonderful. People had been waiting so eagerly for this topic. Thank you so much for putting in that energy.